Hi there. Are you aware of the latest COVID-19 containment measures? Need clarity? Log on to our website, jis.gov.jm, for a listing of the updated restrictions. We wouldn't want you to be caught on the wrong side of the law. Welcome to Jamaica Magazine. I'm Adrian Atkinson, your guide for today's show. Stay with us.
The numbers keep climbing, and yet some of you are still complaining about curfew times. Is that being selfish, or are you being smart? You continue to blame the government, stating they are not doing enough. But the big question is, are you doing your part to help decrease the spread? The unfortunate reality is that far too many people refuse to take the coronavirus pandemic seriously until they or someone they love gets infected. Now, this is what we do not want, and I don't believe I can stress this enough. Wear your mask, sanitize. Of course, we love to hug and socialize, but just ease off some of that right now. Not just for your safety, but also for others. It look hard for your relatives to be home doing all they need to in order not to catch the virus, and you out on the road being reckless and carrying it right home to them. Each one of us needs to help during this fight against COVID-19 as we work to make Jamaica the place of choice to live, work, raise families, and do business in a healthy environment.
Good day, I'm Lorraine Mendez, and this is your JIS News for Tuesday, March 23. The Ministry of Health and Wellness's online registration portal for COVID-19 vaccination is now officially open. Appointments are only being accepted at this time for persons 75 years and older, with the exception of persons who are caring for elders in this cohort. The platform can be accessed through the ministry's website at moh.gov.jm. Meanwhile, persons may also choose to register by phone using the COVID-19 vaccine hotline 888-1-LOVE. That's 888-663-5683. On the day of the appointment, persons will be permitted to have one caregiver with them. They will also be required to present a valid government-issued ID or a letter from a justice of the peace to verify their age. The Ministry of Health is reiterating that even while the vaccination plan is being rolled out, the population is being urged to continue to wear a mask, maintain physical distance of at least 6 feet, exercise frequent hand washing, stay home if they're ill, and adhere to all the protocols under the Disaster Risk Management Act. Meanwhile, the nation's leaders have received the first of 2 doses of the AstraZeneca COVID-19 vaccine. Prime Minister Andrew Holness got inoculated on Monday at the Good Samaritan Inn in Kingston. Opposition leader Mark Golding, as well as the Prime Minister's wife and Member of Parliament for East Rural St Andrew, Juliet Holness, also received their jab Monday. The administering of the doses follows Health and Wellness Minister Dr. Christopher Tufton's inoculation at the Spanish Town Hospital Friday. Prime Minister Holness used the opportunity to renew his call for Jamaicans to get vaccinated.
Take the vaccine when your time comes. Do it orderly. We don't want to see a spike in the numbers as a result of persons going to take the vaccine. Because remember, even after you have taken the vaccine, there is a period of time for your immunity to build. So during that period of time, there is still a potential.
Still on COVID-19, journalists within the public and private sectors are set to receive their vaccine as part of the group of essential workers. So says Prime Minister Andrew Holness after receiving his vaccine on Monday.
We will ensure that all the journalists get their vaccines with the group that would be considered essential in terms of government workers. So I've gotten a letter from the PAJ, and I am going to ensure that the journalists who are so recommended by the PAJ, that they get their access to vaccines.
In other news, at least one developer is confirming the growth in the construction sector as indicated by the Planning Institute of Jamaica, the PIOJ. The sector grew by 7% in the July to September 2020 quarter, with predictions that it will grow another 6.2% in the October to December 2020 quarter. Despite the onset of the COVID-19 pandemic, Managing Director of Alfred Development Limited, Ricardo Foster, says the company has seen steady growth.
When it comes to our working hours, we have to look at the curfew hours that the government or the Ministry of Health has put in place, and we try to adhere to them. because at the end of the day, as developers, we have to play our part in the management of COVID. So if it is that it means that on a particular day we might cannot work based on the hours, then we do that as much as possible. And we plan.
As part of those efforts, COVID-19 protocols have been implemented. This includes temperature checks, the mandatory wearing of masks, the installation of a washstand, as well as an on-call doctor. A commission comprising senior judges has been established to improve the leadership and management of parish courts across the island. The virtual launch took place on Sunday. Chief Justice Brian Sykes says the commission will help to align the plans and goals of parish courts with the overall strategic plan of the judiciary.
The Commission is also to develop and oversee the implementation of best practices in all areas of the parish courts, and to develop strategies to address weaknesses in operations and make recommendations to the Chief Justice and the Chief Judge of the parish court regarding the administration of justice.
Under the commission, each senior parish court judge will be required to submit a monthly progress report on the operational plan of the court to the Strategic Planning Unit of the Court Administration Division for review and analysis. The members of the commission will also ensure there is a clear customer service program being pursued in the courts to improve customer satisfaction. In addition, programs are to be implemented to bolster staff motivation. And finally, the Justice Ministry is reporting that to date, 305 children have been referred to the National Child Diversion Program since its implementation in March 2020. Justice Minister Delroy Chuck says the ministry continues to build the capacity of individuals to deliver the program, especially given the challenges caused by the COVID-19 pandemic.
Recently, we completed the Training of Trainers program, equipping child diversion personnel as trainers to ensure the sustainability of the program with stakeholders that are equipped to work with the children referred to you in the program.
Minister Chuck says efforts are being made to sensitize members of law enforcement and the court system about child diversion. The Justice Minister was speaking at a recently held JIS think tank. Under the program, the ministry has established child diversion offices at justice centers across the island, with 2 independent offices in Clarendon and St. Catherine. The National Child Diversion Program involves implementing measures to divert children who come into conflict with the law away from the formal criminal justice system. And that's it for JIS News today. I'm Lorraine Mendez. Thanks for watching.
Up next, the whereabouts of Prime Minister Andrew Holness during the past week. Take a look.
Prime Minister announces tighter COVID-19 measures, contributes to the budget debates, and holds COVID-19 vaccine town hall. You're watching Jamaica House Weekly. I'm Vaughn Davis.
We have to institute even stronger measures. It is clear that the level of compliance is not going to be achieved by virtue of moral suasion or appealing to the public.
Prime Minister Andrew Holness on Sunday as he unveiled a slew of COVID-19 containment measures. Between March 23 and 26, the curfew hours will go from 8 p.m. to 5 a.m. the following day. On March 26, April 1 and April 9, all workplaces and businesses except those in the essential services will close at noon. The weekend curfew starts at midday on March 27 and will continue all day on March 28, lifting at 5 a.m. on Monday, March 29. The nightly curfew reverts to 8 p.m. on March 29 until Holy Thursday on April 1. An all-day curfew is in place for Good Friday on April 2, lifting at 5 a.m. the following day. On April 3, the curfew starts at noon and continues all day Easter Sunday and Monday, ending at 5 a.m. on Tuesday, April 6. The nightly curfew will revert to the 8 p.m. to 5 a.m. hours on Monday, April 6 to April 10. On Saturday, April 10, the curfew begins at midday, continues all day Sunday, and lifts at 5 a.m. on April 12. Mr. Holness says persons with medical emergencies and those with planned trips overseas will be allowed to move on no-movement days. He was also quick to warn persons among the essential services grouping not to abuse their exemption.
Ensure that you have your ID to present to the police. And just to be clear as well, though you are permitted to move on the no-movement days, it is movement in pursuit of your job. So it is not a wholesale movement license or exemption. Persons with appointments to receive a vaccine will be allowed to do so during curfew hours. Persons will be required to present evidence of the appointment. And how it will work is you will show the text message that you would have received or your email to the police.
Sunday also saw the Prime Minister announcing amendments to aspects of the Disaster Risk Management Act. Burials will be allowed between March 24 and April 13. However, they will only be approved for 9 a.m. to 4 p.m. Mondays through Fridays. No burials will be allowed on weekends or public holidays. Face-to-face classes at all primary and secondary schools have been suspended until April 13. The number of persons at weddings has been reduced from 25 to 15. 12 persons will be allowed at worship centers to allow for online broadcasts. Churches must submit the names of the 12 personnel to the nearest police stations. In the meantime, the work-from-home orders for public sector workers and the stay-at-home orders in effect for persons 60 years and over remain in place. The ban on direct flights from the United Kingdom continues until April 13. Travelers requiring a negative COVID-19 test to enter Jamaica remains in place until June 30. All the other measures remain unchanged.
Those measures, we believe, will significantly reduce the infection rate, will reduce our what they call the R0, the reproductive rate, and bring our hospitalizations down and relieve the stress on our health system.
Still at Jamaica House, Sunday the Prime Minister announced a new initiative that will allow persons in the quick services industry to deliver goods during curfew hours. Dubbed the E-Commerce National Delivery System, or ENDS, the platform will allow certain businesses to provide services up to midnight. ENDS is a partnership between the government and the private sector organization of Jamaica. Businesses seeking to benefit from ENDS must register to access the platform. Mr. Holness says ENDS will be rolled out as a pilot on March 26 in Portmore, St. Catherine.
The system will be fully inclusive and will enable the smallest business operator, the vendor, the jerk chicken man, your favorite fish vendor, to participate.
In Parliament Thursday, the Prime Minister made his contribution to the 2021-2022 budget debates. Mr. Holness used his presentation to announce amendments to the Disaster Risk Management Act, which would see to the introduction of a ticketing system for breaches.
The government is prepared to have the bill reviewed by a joint select committee over the weekend and debate and pass the bill next week if the opposition is willing. This would make the new measures more effective if we have this amendment in place.
Prime Minister Holness also unveiled plans to increase the island's capacity to test for COVID-19.
Chase has been directed to fund the acquisition of a genome sequencer and the requisite accessories and reagents.
And at a virtual town hall meeting on Friday, the Prime Minister reiterated government's commitment to thoroughly investigate an incident in which a vial of the COVID-19 vaccine went missing from the Cornwall Regional Hospital last Tuesday. A probe is already underway, where CCTV footage is being reviewed and frontline personnel present at the incident reassigned.
We as a government, we are intent on breaking that cycle of the improper distribution of scarce public goods. So we take it very seriously, and I've had word with the Minister of Health, and we're going to go with the fullest force to find out what happened to that vaccine and if there is any negligence, malfeasance, or deliberate theft and corruption involved in it, even for one vial.
And that's it for Jamaica House Weekly. Be sure to join us next time for more of the news stories coming out of the office of the Prime Minister.
work to make communities safer by essentially looking at the structures in the community that contribute greatest to social capital building. Try to reinforce, build, and establish those structures in a way that the community can sustain their own safety and own their own peace. When we say, for instance, we're doing a zinc fence removal program, what we're really doing is improving the line of sight. If you're on the street and you can see better what is behind the fences, then as you walk along the street or children play and etc., you're able to contribute to crime prevention. We believe in terms of our mandate and our responsibility that by making communities safer, we can make Jamaica safer.
Up next, all you need to know about the Integrity Commission.
If between January 1, 2020 and December 31, 2020, you were a public official in receipt of total emoluments of $3,500,000 Jamaican dollars or above, or you were appointed or performed the functions of a position listed in the Jamaica Gazette, December 1, 2020, regarding the Integrity Commission Act, you are required to file a statutory declaration of assets, liabilities and income as at December 31, 2020. What to file? You are required to declare all balances and interests in all assets, liabilities, and income received by you, your spouse, and children living in your household. Why file? The Integrity Commission has implemented its zero-tolerance policy. Declarants are required to submit all outstanding statutory declarations. Failure to submit a statutory declaration may attract a fine of not exceeding 500,000 Jamaican dollars or to a term of imprisonment not exceeding 6 months. A person who knowingly makes a false statement in the statutory declaration may be liable to a fine not exceeding 2 million Jamaican dollars or to a term of imprisonment not exceeding 2 years. The Integrity Commission has decentralized the collection of statutory declarations. Submit your statutory declaration for the period January 1, 2020 to December 31, 2020 securely within your organization on or before March 31. Here's how. First, complete your statutory declaration. Ensure you have entered the correct as-at date, which would be December 31, 2020. NA or C attached is never an appropriate response. Use none and list all required balances. Copy or print additional pages where necessary. Ensure all the sections are signed. A justice of the peace is required to validate your signature by signing, entering the date, location, and affixing their embossed seal. Attach the relevant supporting documents. ATM printouts are not accepted. Place the required information on the statutory declaration envelope. Seal the envelope and affix your security seal. Deposit the secure envelope in the Integrity Commission branded collection box or with your designated officer on or before March 31, 2021. Finally, enter your name and date of submission on the Integrity Commission log sheet. The designated officer will facilitate the submission of all statutory declarations to the Integrity Commission by Friday, April 9, 2021. The Integrity Commission will register your statutory declaration and send you a receipt by email on or before Friday, April 30, 2021. For more information, visit our website at integrity.gov.jm or give us a call at 876-968-6227.
Cancer, stress, high blood pressure. Guard yourself against these potentially deadly conditions by eating healthy. Give your body long life with foods such as low-fat milk, dried and fresh peas and beans, unsalted nuts and seeds, fresh vegetables, fruits, and coconut water, and eliminate processed seasonings such as seasoning salt, soy sauces, and ketchup. When it comes to meats, remember to remove the skin to reduce the intake of fats and oils. Meats should also be baked, steamed, grilled, or roasted. Fish is also a preferred protein option. To eat healthy, fill your body with a variety of foods from all the food groups. And remember, eat at a slow pace and in small bites to help aid digestion. This helps to maintain a healthy, balanced, and nutritious diet, strengthening your body to ward off illness and prolong life.
The body is susceptible to illnesses when its immune system is compromised. We're all encouraged to continue boosting our defense mechanism to ward off viral infections. Watch this now to find out how.
Controlling the triple threat of COVID-19, influenza and dengue is a major agenda item for the Ministry of Health and Wellness. This mission requires every one of us to always be vigilant and take preventative measures against the spread of these infectious diseases.
Knowledge is power, and our awareness of this triple threat is the first step to victory. The next step is to do what we know needs to be done and can be done to protect ourselves and the people we care about. COVID is still out there, requiring continued vigilance in our national response to the disease, including the strict adherence to infection prevention and control measures. Masking up, we must add the masks, washing the hands, keeping your physical distancing from others, and sticking to quarantine or isolation as is required.
The Health Ministry has maintained a robust testing protocol in the COVID response to track and trace the virus and slow its spread. That includes government's approval for some private entities to carry out the gold standard polymerase chain reaction PCR test for COVID-19, as well as the antigen test, which has a quicker turnaround time for results.
Combined, private sector entities are now able, for a cost or for a fee, to offer the PCR test for COVID with the sanctioning of the Ministry of Health and Wellness. And so you can go to a microlabs, and they're all over the country. You can get swabbed, samples collected, sent into Carigen, and Carigen will do the test, turn it around, and send back the results. In addition to that, the ministry has also approved Technology Solutions Limited to do environmental testing. And what this means is that this entity, Technology Solutions Limited, is able to go into your company or your home or wherever else in a public space, and they can test surfaces to determine if the virus exists on those surfaces.
Infection prevention measures for the flu caused by the influenza virus is the same as for COVID-19. They include covering the mouth and nose and coughing and sneezing in a piece of tissue, which is then properly disposed of immediately. Both COVID and the flu are highly infectious diseases requiring persons with symptoms to stay at home and avoid contact with others in order to prevent spread. Both have similar symptoms, which makes it difficult to tell which illness is present. Common symptoms of the two infections include coughing, runny or stuffy nose, and shortness of breath.
And so it's very important that as citizens, if you have any of these symptoms, you get checked out by a doctor. And it's also important that you do not panic, but at least get the diagnosis to determine which of the two or indeed the three you may have. Because depending on what you have, your treatment would vary.
The flu season begins in November of each year and extends to March. However, it can be longer, starting earlier in October and lasting until May. The government has made 23,000 doses of the flu vaccine available free of cost for the most vulnerable in the population. Persons can get the vaccine at public healthcare facilities across the island.
The priority for this vaccine would be healthcare workers initially, pregnant women, children over 6 months with chronic illnesses, non-health frontline workers such as the police officers, army, correctional services, customs, and immigration officers, and transport operators. Institutionalized persons, those in the infirmaries, nursing homes, and the elderly, 65 years and older, and those with chronic illnesses. And indeed, I would say parliamentarians too. Persons or public officials, elected officials who are on the ground in the communities, interfacing with a wide cross-section of the population. They would represent a risk. I would certainly want to encourage those, particularly of a particular age cohort, to seek out, and you can get it done privately, the vaccine, because it certainly will assist in protecting you against the flu.
Shorten the duration of any flu-like illness that you may get. The severity will certainly be lessened. The hospitalization will be decreased. What has been shown when we look at what occurred in the Southern Hemisphere for their winter season, it was shown that persons who received the flu vaccine actually, if they got COVID, their impact of the illness was much less, and they also had less deaths in persons who had received the vaccine.
Controlling the population of the Aedes aegypti mosquito, which transmits the dengue virus, is the most potent action to protect against dengue fever, the third tier in this triple virus threat. The mosquitoes are domesticated and usually live in and around areas where people are located. They breed in containers holding water.
We're talking about the vase that you keep on the whatnot, or the bucket that you might keep in the bathroom to store water because you don't have running water to flush the toilet, or the leaking pipe under the sink that you put a pan to catch because you didn't get a chance to fix the pipe. All of those things become breeding sites for mosquitoes and ultimately poses a risk to you.
The national response to this threat has brought the Aedes aegypti indices to a low level, following government's single largest investment of nearly $300 million in the island's vector management infrastructure.
We had in place over 1,244 vector control workers. 222 are permanent, so those are the ones on staff, but we engaged just over another 1,022. Those are still in place, and they have been out in the field doing the work, bringing the messaging, giving out the brochures. We have had 60 new vehicles that have been assigned to the vector control program. 36 of the 60 had vehicle-mounted foggers. We have 76 handheld fogging machines with another 35 in stock.
Citizens, meanwhile, are told to constantly monitor their environment for mosquito breeding sites and take action to prevent breeding.
Tightly cover our water drums, so secure our water storage tanks. The searching the drums and mosquito breeding sites, including our, all the things that I mentioned earlier. Once you see that little wiggly thing in the water, you know that mosquito is breeding in it.
So, as we continue to take responsibility for our own health and the well-being of all around us, let's get informed and take action to stay safe.
Follow the protocols. What we do not want is to be overwhelmed as a public health response, where people don't have access to hospital beds, doctors, nurses, if they need it, because of a dengue, a flu outbreak, or indeed COVID. And I think we can do that.
You have reached the final page of the magazine. Thanks so much for staying with us. Another one unfolds tomorrow, so come back same time on this station. Until then, click on our website and YouTube channel for more informative features. While there, please subscribe to our pages and click that notification bell so you can stay in the know. And don't forget to reach out to us on social media. I'm Adrian Atkinson, encouraging you to think positive as you stay safe.
This has been a production of the Jamaica Information Service, the voice of Jamaica.